So the patient came in with very bad back and bilateral leg pain, right side psoas. There was no active control. It was very difficult for him to walk in to his treatment room, and took a while to find a position of ease. We can see the patient had discectomy, lumbar discectomy, 2 levels. What was the level? L
L3, L4.
3, 4.
Yeah.
Yeah, and then was there another one?
No, just one.
3 and 4.
Yeah.
Okay. So discectomy, and in the beginning the scar was a lot more fresh. It was a little bit oozing, and then it was very difficult to get into this prone lying position. So Herbert always needs to have his leg like that to get comfortable. Okay. So treatment-wise, in the very beginning, we treated his calf muscle. Okay, that was even before lying down into prone. So we lie on the sideline, treat the calf muscle, and then that straight away made him rolling in bed much more easily. Okay, and then we lie down in prone. In the very beginning, it was very tender to touch here, and even just by putting your hands, hovering your hands above the body, you can feel a lot of heat. Okay, so it's definitely not normal. Too much heat here. It was sweaty and very hot. So to do PA, I didn't do this because I think that was way too provocative. Okay, so my PA was more like just finding, with very light palpation, I found there was a place that was a bit tighter. Okay, and then a gentle pressure down like that was my PA treatment. So that's very safe. So we are basically treating the soft tissue without pushing on the vertebrae. Okay, and often just by doing that, what do you feel, Herbert?
I feel something in my leg. Right.
Can feel the
around the calf.
In the calf.
Yeah.
So that is the treatment, and basically we just hold that position for a good 40 seconds. That is the treatment.
And now it's a lot different. Like in the beginning, when he just press it, I feel a really bad pain, like going towards the end of the foot. So it's kind of shooting. It's not shooting pain, but similar pain when it presses. But now it's a lot different. It's really mild now.
Very mild. In the very beginning, just a light pressure like this was very, very painful. It reproduced his leg pain. Okay. However, just by treating here, he still had to lie down like that. He still had to lie down like that. It was not until we started moving up, treated up here, and even all the way up to around this area. So once we treated that area, that was for the first time we were able to have the leg
without any issues.
Like that.
And I can't even roll, like change position. It feels like I don't have any power to do anything. Can't lift from that.
So by treating up in the thoracic spine, it really made big improvement down the leg. It's a lot better now than in the past. In the very beginning, so anywhere along the spine was very tender to touch. or even go up to the head.
Yeah, a little bit in the head.
Yeah, it can feel really tight. Like in Chinese medicine, you see sports people, they the athletes, professional athletes, they get back pain when before they go up to the court for competition. They have an acupuncture needle right on top of the head.
Okay.
Yeah. And that takes a lot of the pain away. This is on the same meridian. So this is the Du meridian, Du Mai. Or in English they call this the governing vessel. So it governs all the yang, the yang, all the yin and yang. It governs all the yang. Yang is all the musculoskeletal system is yang. I shouldn't say that. Yang is if you are on a quadrupedal position, so like a dog, areas where the sunlight can fall on the body, that's yang. Okay, so it's the dorsal lateral part of the body is the yang. Okay, where the ventral medial part of the body is yin. That's where all the major blood vessels are. Okay, I'll say 95% of musculoskeletal conditions are the result of excessive yang. That's why excessive heat. You can feel excessive heat energy. So you want to reduce that heat. Sometimes I do that. You can just do that to keep it cool. It helps. When you can feel the body is too warm, the body part is too warm, you want to do something to cool it down. So, and then with the scar tissue, remember how we treat the scar tissue. So we apply a bit of a traction, skin distraction, and then just scratch the end. Quickly, like that. And sometimes, if it's still oozing, it may actually cause a little bit of bleeding. We don't want it to bleed too much. Sometimes it's unavoidable, but we don't want it to bleed because that will stop your treatment. Okay, so you distraction and then do that. Usually you can see the end is usually the worst. Okay, so the middle part you can scratch across, or you can basically scratch across. Doesn't matter. Okay, like that. And then also one very good exercise is if you feel just with the tip of your finger, you can feel the skin tissue texture is a bit different here. So it's a very light pressure. So if I slide my finger across, from time to time I can bump into a little bit of a ridge. Okay. So where you feel the ridge is usually it's too tight. Okay, there's a blockage. And then once you identify the blockage, you can either just very light pressure down like that, and it's actually quite tender, isn't it? Okay, you can treat. Well, here you can do PA. You can actually do PA here. It's pretty safe. Just don't do PA here. Okay. Or you can go across. You can go across. Yeah, it's actually worse on the right side. Yeah, you can feel that. Yeah. Okay, so pretty tight here. So I think the key is being able to feel that tissue texture, the different tissue texture. So this is the patient that you need to practice soft hand. Your hand has to be so soft so you can detect any little problem. And also when you do the treatment, you run a lot less risk to cause damage. So let's do a couple practice. Number one, I'd like you to just run your finger across the spine and then really feel for the change in tissue texture and see how many levels you can pick up. Okay, number one. Number two, if you can identify the tight spot there, okay, then you apply a sustained pressure on it. Number three, you go across it. Okay.
Can we go perpendicular? Like go perpendicular?
You want to go this way?
Yeah.
Yeah, you can. You can. Yeah. Or you can do that, or slide it off to the side. Okay. This is a dual meridian, dual line. Okay. And next to it, there are a series of spatial meridian points. They are not meridian channels, but they are meridian points called 华佗夹击穴. 华佗, you know 华佗?
Yeah.
It's the famous ancient Chinese doctor. 夹击, jia, it means pinch. Ji is the spine, so pinch the spine. So those two, there are pairs of meridian points along each side of the spine. Okay, so it's called 华佗夹击穴. It's very useful. It's not the PA. What we learn in PA are usually too lateral. Okay, it's pretty central, pretty medial. So that's where the meridian pressure point is. Okay. All right. Let's try.
Okay. Alright, ครับพี่ตายอ่านทีน
Okay. Just.
Do this. That's what it is. Okay. Let me show you. Something here.
This one? Yeah, this one.
Yep. You can feel it.
Yep, that's the totally right spot. Yeah, good.
Okay. Now you can apply a bit of pressure.
Good.
That's good. Yeah, that's good. You want the tip of your finger on the spot. There could be just like a rice, a spot as big as a rice grain. Got it? Alright.
I think I got it.
Okay, if you got it, then you get a little bit of just tiny bit. Oh, that'll do. No, that will.
Is that it?
That's okay, don't worry.
Still look.
Yeah, that's all.
Yeah.
Don't worry.
This one. Okay. Yeah.
Move across or perpendicular. And then really feel the tissue texture on the right side.
Yeah.
It should feel different.
You can feel a small bump here.
Yeah, that's right, bro.
Yeah. Right here. And then another one there. Yep. Okay.
Okay, I think you got it. Alright. Just keep traveling up and see how many levels we can feel.
Okay, yeah.
So when you press in the beginning, I feel something in my right leg, just for a few seconds only.
This one.
That's the bite.
going up.
Keep going. There could be another one.
There's one too.
Oh, that's
Is that
yeah.
radiating down anything to the leg?
No, it's not.
It's
It's
just
the local pain.
very local.
Yeah. Oh, that's too much pressure.
Okay.
You know, it's because it's kind of bend here,
Mm.
so it's free.
Good.
Have your little tiny, okay?
Now it's done.
So let's start just down here. Okay. You wanted to just run your finger across and feel the texture.
One here.
Yeah.
But this is the most obvious one here.
Mm-hmm. You can feel that.
Just here.
Mm-hmm. Okay, slow down with our palpation. So here, you can really feel that. So if you go, so with the treatment, let's not see this kind of fast movement. Okay, so it's always very slow and smooth, no matter where you are. It's always slow and smooth. And then you need to be honest to yourself. What do you feel? Can you really feel the change in the tissue texture? Yeah,
So
that's
there's
good.
one change here.
Yep.
Already a little bit.
Good.
And most obvious one is this one here.
Good. All right. So let's pick one. So pick this spot and then go across it. How's that feel, Herbert?
Yes. A little bit tense. Oh, pain, a little.
Yeah, feels
But it's a local pain.
okay. It feels good. Thank you, Carl. Very good. Right. The next exercise is we're going to move on to this area. So I'd just like you to very gently palpate about one finger away, one and a half finger away from the scar, and then you might want to go up and down or in and out, okay, to find a spot that really feels tight, okay, and then your treatment would be just gently pressed down. And then if Herbert feels something in his leg, can you feel something in your leg?
Right now?
Yes?
Really mild.
Yeah? If he can feel something in his leg, then you got it. Okay? Just make sure you take your finger off very slowly. Okay? So I think try to trace this. You let us know if you feel.
Yeah, I will try to figure out. Whether you're pressing the right place. It's really mild right now.
Very mild.
Yeah.
Okay.
Only in the right leg.
Mm-hmm. Alright.
But
Yeah.
it goes away. It's
Slowly
only for a
come
few
up.
seconds.
Okay, kid.
Is there anything on the left side?
Yes.
Yeah.
Yes. Okay. Alright. Yes, there is something on the left side as well.
Yeah.
You want to try the left side?
Yeah, I want to try.
Let kid try the left side. And which side do you think Harper will feel the leg pain?
Mostly on the right.
Yeah, even you work on the left side, he will feel it.
Sometimes, yeah, only on the right, but
Yeah.
not on the left.
Left side is not as easy to feel.
Feels different on top here. And it gradually gets softer.
Mm-hmm.
Go down.
Okay. Just I think you press a little bit too hard. I'll show you. So this is you definitely have to be very light hand for this.
And when it's on the right point, you can't feel the finger pressure on the back, but you feel really bad pain in the leg.
Mm-hmm.
So yeah, if it's on the right spot, I can't feel the finger on my back.
Yep.
I feel the pain
In the leg.
in my leg.
Okay.
And when you put the take off your
Finger.
finger, it slows down the pain and it will like relief after a few seconds and
Yep.
goes away. So.
Yep. So let me know if you feel in the leg.
Yeah, I try to find.
You can feel it. Yeah. So that's my palpation. You can see it's very light. But I think you went a bit too deep. That's why all the sensory receptor in your fingertip, they are all fired up, and you can't differentiate. It becomes less sensitive. You just have to be so light-handed. Especially, say sometimes you see a very obese patient, and you think you have to press harder to find the spot. No, it's the opposite. Even with obese patient, you actually have to go even lighter.
When you press it, I feel a little bit in my leg right now, right? But it's really mild.
Yeah.
Because I'm a little bit okay now. Earlier it's really bad, but now I feel there's something, but it's very mild.
Okay.
And it's in the calf, back of the calf, kind of.
In the right leg.
In the right leg, no left, nothing in left.
Can you feel it now?
Yeah.
Okay. Tina, can you have a feel on the left side?
Yep, that's the right spot. But for some reason I don't feel much in my right leg right now. But I feel you're pressing in the right place. Yep, even on the right spot, it's really, really mild on the right, like really mild.
So you can see it can sometimes be really close, just one finger to the scar, and sometimes it can be a little bit further out. Okay, sometimes it can be even a lot further out. So you just need to palpate very light pressure all the way.
And it's a little bit far from the bone, center bone.
Mm-hmm.
So,
Kian, you haven't tried the
All right, side.
yep, that's the right spot, bit low there. And if there's a feel something like that.
Is still the right spot?
And like right now, pressing really mild, not much pressure, but still I feel something in my leg. So yeah.
So treatment would just be sustained pressure for 30 seconds or longer.
Yep, that's the right spot.
So for this kind of patient, I think a straight PA, like what the uni taught us, is contraindicated. I had one patient many years ago, similar presentation, and I did a central PA, and his condition got worse. So be very careful with the very unstable spine like this. Don't do central PA like the university taught us. Okay, very good. Alright, slowly come off. Okay, scar. So with a little bit of cream, you want to distract and then just scratch. So this is almost broken, so just try a couple and that's it. It's safer to do here. You can also stretch that way and then do that. Okay. Probably need to change, swap hands. Yeah. That's better. So because you are scratching that direction, so the distraction is best to go that way.
Yep.
Yeah, so you stretch that way instead of that way.
Yep.
So you go that way. Yeah.
Also, the stretch and the scratch needs to be in the same direction.
Ideally.
Yeah.
I don't know if it actually mattered, but that's how I would do it. And then just watch your posture here. Get into good habit. It's better with one finger. Good.
Mm-hmm.
When you're ready, you can swap.
Okay.
So, scratching. That's good. Alright, that looks good. Can you hold the camera and let it run? Let's do the scar first. Scratching. Simple, easy. Okay. Mm-hmm. Yep. Okay, looks good. Yeah, next one, just come over this side, it's so easy to feel. So that pressure, just feel if we can find the spot. Just very gentle, very gentle. Yep. Even gentler than that. There, stop there. Just gently push it down. So your pressure shouldn't kill an end. Okay, should be so light. Let us know if you feel it.
Yeah.
Yeah.